Hello, bonjour, and welcome to the info webinar for Healthcare Excellence Canada's new program, Sparking Change in the Appropriate Use of Antipsychotics. It's so exciting to have you all here joining us to watch the people streaming in to help us launch this new program. So I'm Nicole Pollock. I'm a senior program lead on the Health Innovation Programs team here at HEC, and my pronouns are she, her. So I'm very excited to tell you about our new program. If we're pleased to offer French simultaneous interpretation first off. So if you'd like to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your screen. And we invite you to share your questions and comments in either English or French at any point using the chat box. And we'll aim to address any of your questions during the Q&A session at the end of the webinar. If you need support at any time, please reach out to our tech support using the chat feature. And this session is being recorded and will be available on our website in the next couple of days. So I wanted to start by acknowledging that I'm joining you from my home in Ottawa, which is the traditional and unceded territory of the Algonquin Nation. I recognize and appreciate my ability as a settler to live here with my family. Healthcare Excellence Canada is also located in Ottawa, but with staff all across the country. HEC honors the traditional territories upon which our staff and partners live. We recognize that the stewardship of the original inhabitants of these territories provides for the standard of living that we enjoy today. Truth and reconciliation is an ongoing journey, and as an organization and individuals, we must commit to not repeating past mistakes and to work towards more equitable and respectful relationships with First Nations, Inuit, and Métis. So I invite you to share who you are and where you're joining from in the chat box. Again, it's so nice to see some familiar names and to have some new folks joining us here today as well. So a bit about Healthcare Excellence Canada, if you're not already familiar with us and what we do. We're a not-for-profit funded by Health Canada, and we formed through the amalgamation of Canadian Foundation for Healthcare Improvement and the Canadian Patient Safety Institute. So we collaborate with diverse partners across the country to spread innovations, to build capability, and to catalyze policy changes that improve healthcare safety and quality. Our strategy to shape a future where everyone in Canada has safe and high quality healthcare focuses in part on care of older adults with health and social needs. So this includes fostering safe person-centered care in long-term care, which is the overall goal of this new program. Next slide, please. I'm excited to introduce our speakers for today. First, we'll be joined by the wonderful Cynthia Sinclair, who's a coach and advisor with HEC for this program. Cynthia is a retired registered nurse whose 35-plus year career has spanned across several sectors, though her passion is clearly long-term care. She has served a variety of roles with the Winnipeg Regional Health Authority, as well as becoming director of care of a large Winnipeg long-term care home and CEO of a long-term care home in England. Cynthia is a graduate of HEC's Extra Fellowship Program, where her intervention project actually set the foundation for the future AUA collaboratives with HEC across the country. So using her expertise and experience, Cynthia has worked tirelessly with many long-term care homes and organizations to create and sustain person-centered care environments that improve the lives of residents. And next, we have the wonderful Julie Weir, who's also a coach and advisor with HEC on this program. With over 20 years of nursing experience, Julie holds a Bachelor of Nursing and a Master of Nursing from the University of New Brunswick. She's worked in both the acute and long-term care sectors with significant time spent working at the provincial level with the New Brunswick Association of Nursing Homes. During this time, Julie led the provincial scale of several quality improvement initiatives, including the Appropriate Use of Antipsychotics initiative and the implementation of the Inter-RI LTCF. Julie currently serves as the president-elect to the board of directors with IPAC Canada and is the regional nurse manager of infection control with Horizon Health Network in New Brunswick. Julie continues to work with HEC as a coach for several initiatives and is one of the long-term care co-leads with Choosing Wisely Canada. Next, we have Chelsea Hawk-Filzer, who's a director of health system improvement at Health Quality BC, where she builds provincial quality initiatives within the mental health and substance use and long-term care sectors. Chelsea has a Master of Arts in Community Development and a graduate certificate in evaluation from the University of Victoria. She is also a fellow with the International Society of Quality in Healthcare, Over her career, Chelsea has enjoyed administering the Patient Voices Network as an important platform for connecting people with lived and living experience as partners to improve care. Updating the BC Health Quality Matrix and leading Health Quality BC's annual Quality Forum, which everyone loves. And she supported learning programs such as the Quality Academy. The Health Quality BC has partnered with HEC to support BC teams in multiple long-term care programs, including the recent Reimagining Long-Term Care program in BC, which focused on the appropriate use of antipsychotics. And last but not least, my very own colleague here at HEC, Kirby Kervin, will be joining us to share more about how you can register for the program. So once again, feel free to drop any questions into the chat box throughout the presentation, and lovely to see everyone's introduction still streaming in. Thanks for sharing. So the objective of this info launch webinar are to provide an overview of the program, to hear from past HEC AUA initiatives about why this work is so important and impactful, and then to review the online registration process, show you how it's very quick and easy, and then save time to answer any questions you may have about the program or about how to register at the end. So, sparking change in the appropriate use of antipsychotics. This is an awards-based quality improvement program that will be delivered by HEC starting from November this year, 2024, going until February 2026. So we keep saying this is the launch webinar because online registration opens today, and then the official programming will start in January. The objective primarily, of course, is to improve the appropriate use of antipsychotics through innovative non-pharmacological interventions and our person-centered care approach in long-term care homes across Canada using this AUA approach. Next slide, please. So the AUA approach leverages person-centered care as a means to deprescribe antipsychotics that no longer benefit and potentially cause harm for people living with dementia. Person-centered care is a proven and safer alternative that addresses the root causes of responsive behaviors and offers many benefits for residents, care partners, and care providers. So HEC first identified this AUA approach through our extra executive training program with a team in Winnipeg, which Cynthia will tell you more about in a moment. And we partnered with long-term care homes and provinces across Canada to spread the approach and have supported hundreds of long-term care homes over the past decade to safely deprescribe antipsychotics for people living with dementia, which Julie will also tell you more about in a few moments. Next slide, please. Yeah, program supports. So whether your team is just setting out on your AUA journey, or if you need help to spark your deprescribing work, or if you're already showing promising results, this program is designed to help you move the dial on AUA. So upon registration, teams will be assigned a coach who will help teams plan for their quality improvement initiative. And then they'll be invited to attend group coaching hubs to connect and learn from other homes across the country, and can also request direct feedback from coaches or other subject matter experts as necessary. There'll be a series of 7 different award opportunities, ranging from $2,000 to $10,000 per home per award. And there'll be monthly webinars to learn more about the AUA approach and the award opportunities. We engaged our expert advisors to help build a toolbox that is a curated list of resources related to the AUA approach, and it's organized in a really beautiful, user-friendly, searchable format. And lastly, teams will receive a monthly emailed bulletin to hear about upcoming awards, events, opportunities, and any new resources. This program design is a blend of a traditional quality improvement collaborative integrating this financial awards framework. So it allows for more flexibility where teams can choose the extent to which they take part in learning and award opportunities based on that home's needs and capacity at the time. So there will be lots of supports as outlined if and when a home is able and ready to take advantage of them. And the measurement and reporting requirements are really meant to be minimal, meaningful, and manageable. So as with any quality improvement initiative, teams will be encouraged to collect and monitor related measures. However, the only deliverables to HEC are if and when a team chooses to submit for an award. So this is the webinar schedule. There'll be monthly webinars alternating between announcing the launch of the next award and webinars focused on that AUA approach content and topics. So the award launch webinars will be just for registrants in the program. So you do have to register to be able to submit to the awards and attend these award launch webinars. And they'll provide context around the quality improvement and the measurement aspects of the award submission, and of course, details on how to submit for the award. And then the AUA content webinars will be open to the public. Anyone can register, and there'll be a great opportunity to hear from a variety of guest speakers and subject matter experts about how to improve the appropriate use of antipsychotics. So this is a quick overview of the 7 financial award opportunities, and they're also available on our website. So the first couple, the Kickstarter awards, are meant to encourage homes to register early for the program, to join us for that full quality improvement journey, and just that, to get kickstarted on your AUA initiative. So upon registration, each site gets 1 ballot entered into the draw, and then ballots carry forward to the second Kickstarter if you weren't selected in the first round. Then for the Person-Centered Care Award and the Workforce Safety Awards, these 2 are more of a qualitative narrative award submission. So as long as the minimum requirements for the award are met, those will also be entered into a draw. And then the awards that include the data measurements, so the Improvement Plan, the Progress Award, and the Impact Award, these are ones that will be adjudicated by reviewers from HEC and external partners based on set scoring criteria, which is articulated in the terms and conditions when you register for the program. So just before I wrap up on this program overview, I wanted to give a quick shout out, acknowledgement, and big thank you to our supporting organizations who have helped and are continuing to help promote this program, and who may be some of those volunteer reviewers for the award submissions. So in summary, the program registration opens today. It's open to any long-term care home across the country, either currently working on AUA or interested in implementing any changes to reduce potentially inappropriate use of antipsychotics with their residents. Online registration is from our HEC website, quick and easy. Kirby will give you a sneak peek during the webinar. Again, registered teams will receive various supports to implement changes and will have the opportunity to win 7 different awards ranging from $2,000 to $10,000 each time. And of course, the opportunity to improve the AUA and person-centered care in Canada. So now I'll turn it over to Cynthia and Julie to provide some of that history of HEC's work on AUA and also why it's so important and impactful. What do you, Cynthia?
Thank you very much, Nicole. I really appreciate it. Welcome to everyone. I'm really excited to be with you here today. Next slide, please. I wanted to start by giving you an understanding of the problem or the burning platform, so to speak, and where we are today. As you can see in the slide, in 2013, the data showed that about 1 in 3 residents in long-term care across Canada were taking inappropriate antipsychotic medications without an underlying diagnosis of psychosis. And when Joe Pushniak and I did our extra project back in 2011 and 2012, we saw very similar kinds of numbers. But what's the problem with this? Well, the problem is that, first of all, antipsychotic medications being used for people with to manage symptoms of dementia is an off-label use, so never designed for this group of people to begin with. These medications carry a large risk to them, including increased risk of stroke, heart attack, falls, death. And incidentally, they do little, if anything, to help mitigate some of the reactive and responsive behaviors that become so problematic for people living with dementia. When Joe and I did our literature search, we also saw that the literature is saying 5 to 15% usage is probably more appropriate, and these medications should never be used long-term in this population. So because of the work with the AUA over the subsequent years, a lot of great work was being done by teams across the country, and the rate dropped down to 1 in 5 residents by 2018. So that's a tremendous improvement, and shows that this is worthwhile work that can really happen. Unfortunately, COVID hit us, and we all had to live through some really awful, awful times. And certainly, all of you can appreciate how difficult it was to work through all the restrictions and isolation requirements during COVID. Residents had a very hard time with it. I think staff had an increasingly more difficult time applying person-centered care principles in that environment. And because of that, we are starting to see an increase in the usage. Again, we're up to 1 in 4 as of 2022. So it's time now to start getting back to this really good and important work. And that's why you've all been invited to join this info webinar, and hopefully you will register for this very unique opportunity, this awards-based program this time around. Next slide, please. So the AUA approach was described by Nicole quite nicely. I'm going to talk a little bit more about that as I talk to you about our extra experience. I said that we saw similar numbers in 2011, 2012 when Joe and I were developing our improvement program, our project. And what we saw in Winnipeg across the 39 homes was usage anywhere from 10% all the way up to 50% time. This puzzled us because in the previous 7 years, we had been delivering intensive PIECES education to all our homes. Homes were invited to send 2 to 4 people every quarter to these 5-day intensive PIECES sessions. If you're not familiar with PIECES, PIECES is a dementia care model. Surprisingly, our numbers never changed over 7 years. We still had the same average across our regional health authority of 30%. And when Joe and I stopped and looked at that, we thought, well, why? And what we discovered is, first of all, people didn't feel supported when they went back to their homes. There was a small group of people trying to make enormous change without that foundational support, not knowing even where to start. So we realized that knowledge and education alone doesn't result in knowledge translation or change at the bedside, and it certainly doesn't result in culture change. And that's why Joe and I developed the program that we did. And so when you saw that circle of the AUA, those 5 pillars, they include the very important gathering and collecting your data so that you know where you're at to begin with. And as you go through this, conducting medication reviews with your team, which hopefully includes your physician and your pharmacist, and enhancing supportive care, developing a real person-centered, individualized care plan, using the entire team, not just the nursing team, but the entire team, using their observations, their skills, their knowledge, and bringing in the family members to create that really specialized, individualized care plan, which you then apply as you start the deprescribing. And you deprescribe in a systematic, controlled way until you discontinue. When Joe and I worked with our pilot site, which was a 200-bedded facility, in 6 months, we were able to discontinue medications by 27%. We probably reduced the dosage in many others, but we didn't capture that information. But we did that by working with the executive team, the management team at the home. They became actively engaged. They attended education. They actively supported their teams in their units. And we engaged the physician group as well as the entire employee team at our site. And so we found that this became a very translatable kind of program. And in fact, CIHI and I started to partner to put the AUA program into a collaborative format. And so in 2015, we had the first national collaborative where teams from east to west joined us on a year-long collaborative. And they did amazingly wonderful work. We've done many collaboratives since then, including the virtual collaboratives that we have had to do because of COVID, and we continue to do now. One of the teams that joined us on the national collaborative was the team from New Brunswick, and they were so excited about the program that they decided to embark on a province-wide collaborative. And I'm going to turn it over to Julie now talk about that experience and talk about the experience of some of the collaboratives in the Eastern provinces. Julie, over to you.
Thanks so much, Cynthia. Next slide, please. So as Cynthia mentioned, as her and her partner created the AUA Approach and they went to a pan-Canadian collaborative, from there were collaboratives that came out of that. So in New Brunswick, we did a province-wide collaborative, which included 58 long-term care homes at the time. Then following that, there was a collaborative that involved the homes across PEI and Newfoundland, so 39 long-term care homes in Newfoundland and the 9 public homes in PEI, along with 3 homes from Ontario that were part of another group called SQLI. And of course, Diane is on the call. Quebec did fantastic work with 313 public CHSLDs and long-term cares in Quebec. So across all of those collaboratives, what we saw are listed on the right, the results achieved. So we saw safe reductions and discontinuations of appropriate or antipsychotic medications in over half of the participating residents. So that was very exciting that regardless of the challenges, regardless of the scenario, regardless of the context, they all saw over half of their participating residents, so in their cohort, saw reductions or discontinuations. Amongst those who had the reductions or discontinuations, what we also saw was no increase in responsive behaviors. We also saw improvements in residents' quality of life, and I'm telling you, there are resident stories out there that would just melt your heart. We saw more independence, mobility, social engagement, fewer falls in many instances, and of course, improvements in staff culture and engagement with families. We saw real experiences where staff maybe hadn't experienced the value of having families involved in the care planning, and we saw huge transformations in models of care across many different homes. Next slide, please. So we've talked about this graphic. This graphic was created because we were having discussions with different organizations, different groups of people, different professionals, saying, you know, we're here with the AUA. We're here with the appropriate use of antipsychotics. And when you just hear the title and you don't understand what all is involved, the assumption is it's just about the medication. But it's not just about the medication. It's about so much more. So we created this graphic to really explain the model that we take when we apply the AUA approach in any scenario. So in the center, we talk about the resident. So in everything we do, in every medication review, in every discussion with family, in every care planning exercise, we have to hold the resident in the center. Because if we're not doing it with the resident in the center, either figuratively or literally, then we're not doing it for the right reason. So starting in the bottom, we talk about enhancing supportive care. So understanding what is helping us to understand what's happening with that resident. You know, responsive behaviors are often an unmet need or out of frustration because of the changes that that individual is experiencing. So we have to understand what supportive care we have available and really enhance that to make sure that we're meeting the needs of the resident. Moving up to the purple circle, we take a full team approach. Everyone who has interactions with that resident has a say. So how we do that a lot of the time is through the huddle experiences, and where you bring the housekeeper, the dietary aide, the family if appropriate, and all of the team to come together to say what worked today, what didn't work today, what lessons can be learned. At the top, we talk about deprescribing and understanding that there are lots of deprescribing tools available. And that's fantastic. It's important that the organization determine what's appropriate for them. So what I love about HEC's approach and CFHI before them was that they're not prescriptive. We want you to tell us what you're using and is it working? If it isn't working, we can help you find other tools, but understanding that there are lots of tools available, lots of great tools, and we just want to know what worked and what didn't. Collecting and monitor data is integral to this process because it's important that you understand where you're starting from and where you're trying to move to. And it's the little changes that can get excitement amongst your staff and your residents and families. So we'll help you with that as coaches. And of course, conducting medication reviews. Medication reviews is something that in many provinces, like mine in New Brunswick, it's a requirement as part of the licensing process. But I would say before the AUA, and homes in New Brunswick can have told me that this was their experience, before the AUA, it was just one of those boxes that they needed to check. Through the AUA, and as a result of the AUA, they're having much more fulsome discussions because they feel like they have a real focus and a real need to have everyone on the same page. So that's the graphic. That's what it's all about. That's the approach, and we're excited to have you all on board. So I'll turn it back over to Nicole to continue with the slides.
There, I'm back. Thank you so much, Cynthia and Julie, for that wonderful quick overview of the history of AUA and programs at HEC, and as you alluded to, CIHI before that. And the approach will be continuing through this new program. So now I'd like to hand it over to Chelsea to come on and talk about some of the programming we've partnered to do last year in AUA, the work they continue to do in BC, and how that will be coordinated and intersect with this program. Over to you, Chelsea.
Thanks, Nicole. Yeah, thank you so much for that overview. That was really helpful. So hi, everyone. I'm Chelsea, and I'm joining from the unceded territory of the Musqueam, Squamish, and Tsleil-Waututh Nations. On the next slide, you'll see a photo of the beautiful and precious place that I have the privilege of living on, colonially known as Vancouver. I'm a director of health system improvement with Health Quality BC, as Nicole said, and we've been partnering together with Healthcare Excellence Canada since 2020 on the variety of programs that they have been offering for the long-term care sector, including last year's Reimagining Long-Term Care program. Our role at Health Quality BC has primarily been on providing the coaching supports for any BC care homes who have participated. And we are just thrilled to be partnering again this year on the new Sparking Change in AUA Awards program. And I really appreciate the time that the team at Healthcare Excellence Canada has given me today to provide a little bit of extra context for how we'll be approaching supports for BC teams together, because it is a distinct path for BC homes as we work together across the province on this. Next slide, please. I'm going to start by just giving a quick background on how the Reimagining Long-Term Care program ran in BC last year, and then I'll take a few moments to share with you what we've been working on since the program ended and the supports that will be offered to BC care homes who register for the Sparking Change in AUA Awards program. So next slide, please. For the Reimagining Long-Term Care program last year, we took a slightly different route in BC and actually were prioritizing the AUA work for the homes who registered in the program. There were almost 200 homes in BC that applied last year, and we were able to work with 78 of them throughout the year, again, specifically focusing on the antipsychotic work. Health Quality BC provided coaching supports throughout the program, and we worked really closely with BC health authorities, regional leads, and a provincial advisory group, and also offered some AUA-specific webinars for the teams in BC. On the next slide are a few just outcomes that we had across the 78 homes who participated in the program. So as of June of this year, they were able to reduce their rates of potentially inappropriate use of antipsychotics by 3.4% on average, according to the unadjusted rates from CIHI, which is what we've been considering for the purposes of quality improvement. There was variation within that group. The 78 homes we worked with had been experiencing some of the most significant challenges in this indicator heading in. Some saw huge changes with reductions up to 30%, and others continued to experience challenges, while a few remained relatively stable throughout. So overall, we're seeing a continued gradual decline, which is a good indicator that we're sustaining our efforts. And I really want to acknowledge the hard work and compassion of the care homes and the health authorities here in BC who are continuing to prioritize this work, as are all of you on this call today. It's really important, and thank you for bringing us back to the why of this before I started speaking. So on the next slide are just a few learnings that we had from last year. We know that care homes have been doing this work for a really long time, and generally folks know the best practices. So it's not necessarily an information problem. It's often a structures issue. And last year, the homes that had the biggest successes here in BC were the ones that had internal supports dedicated to this work and really strong leadership supports that prioritize this. Homes that focused on an interdisciplinary approach were able to really move the work along. And there were some homes that found success in implementing non-pharmacological approaches that increased engagement. Things like student ambassador positions, virtual reality, and sensory equipment. And the 3 homes that had the biggest declines, we're talking, over 30%, focused on their RIE coding and training, ensuring assessments were happening on a quarterly basis, and that these assessments were really accurate and reflective of the data, and also really good care planning. So we know that everyone wants to do the right thing, and what we've learned is it's about enabling them to do it. So what we really took away from last year and other work we've done, throughout the years is that this can't be something that's just off the side of one person's desk. Homes really do need to have sustainable ways of embedding these practices in their day-to-day operations. So we can use QI tools and methodologies to make improvements, and remember that this can't just be time limited and have things fall away afterwards. So there's a lot of excellent pieces of work across the province, across our country, that we can continue to build on. Next slide, thank you. It's like you're reading my mind. So since the Reimagining Long-Term Care program ended in December, we've been working with our partner organizations here in BC and Healthcare Excellence Canada to take what we know from best practice and some of these learnings and think about how we can make it easier for homes to make these improvements amidst the many, many things that are on their plates every day. Like I said, there's a lot of information out there, and there are some really excellent resources from across the country for care homes to use to support their appropriate use of antipsychotics. It can be really difficult for homes to prioritize where to start, what to work on first, and what resources and strategies are, where they should be starting to make improvements. So we have been curating a new toolkit meant to support homes with those challenges. The toolkit contains an online self-assessment for homes to complete, and then some very curated resources and templates to help facilitate them making some quality of life improvements. And our tagline is, it starts with asking why. And we chose that because we know that if we stop and ask the question, why are we giving this person antipsychotic medication? What behaviors are we trying to change? That questioning is a really important first step that can lead to better outcomes. And the goal is to ensure that we also have the resources and systems in place to support that and to support staff to feel good and confident in reducing medications, specifically antipsychotics, safely when appropriate. So one piece for BC care homes to know is this toolkit also aligns with the long-term care quality framework that was released here in BC last April, as well as implementation of the use of medications to manage behaviors policy released in September, as well as some of the long-term care service accreditation standards. So we've created things around 8 key elements that you see on the screen. It's not intended to be exhaustive. It does align with much of what Julie shared earlier. And for each of the 8 key elements, there will be 1 or 2 questions for homes to rate themselves on a scale of 1 to 6 in an online form. And then they'll be automatically directed to a landing page for the particular key elements that they should focus on based on their ratings, along with some curated resources to help make improvements in that area. And the idea of making the tool online is ideally it becomes, a bit self-sustaining over time, where homes, from anywhere can go on and reassess themselves every 6 months or so to track how they're improving in these areas over time. And it's meant to be really quick and a simple way to help prioritize where to start. So on the next slide, this is probably what's most relevant for this conversation today. We are trying to think about how we can help homes get started on this and introduce and embed the toolkit into their operations. So to support that, we're launching an AUA and long-term care action series with registration that is also opening today, and that was no coincidence. So the action series starts in January. And that toolkit and the self-assessment that I described is what we'll be using to really guide the improvement journey throughout the action series that'll run until next fall. We hope to recruit as many BC homes as possible to participate. BC homes will be provided with learning webinars, opportunities to learn from each other, coaching supports from clinical and quality improvement experts over the course of the 8 months. And they'll go on a distinct but aligned quality improvement journey with a simple, tailored quality improvement guide and help with collecting and learning from data, which is very important, as Julie spoke to earlier. Next slide, please. So Health Quality BC and Healthcare Excellence Canada have partnered together to combine the action series with the awards program so that BC homes who are interested in advancing person-centered care through the appropriate use of antipsychotics can streamline their participation in both. So for BC homes, this means that when you register for the action series, through one simple click on the registration form, you can also let us know that you're interested in registering for the HEC Awards program that we're all here learning about today. So that way registration is streamlined and will all come through Health Quality BC. We'll provide you with a code that you can then use to register for the awards program. And we'll be providing the coaching supports for BC homes to assist you in applying for the various awards distributed throughout the whole 15 months of this awards program. So it's a really fantastic opportunity for our BC homes to join both the action series and this excellent awards program to get some additional supports for what we'll already be focusing on and have been focusing on in our province. So that brings me to an end of what I wanted to share today. Thank you so much for your time. I'll pass it back to you, Nicole. Happy to answer questions, and I'll also pop my contact details in the chat.
Thank you so much, Chelsea, and happy co-launch day. Over to Kirby to tell you about how you could register now.
Right, thanks, Nicole. So good morning, good afternoon, everyone. My name is Kirby Kervin, and I'm a program lead here at HEC. And I'm coming to you today from Chelsea, Quebec, which is just across the river from downtown Ottawa, which is part of the traditional unceded Algonquin territory. So I wanted to take just a few minutes to introduce you to the registration process for this program and walk you through the main steps for submitting your registration form. So if you'd like to apply to the Sparking Change in AUA Awards program, you can find the registration link on the program webpage or at the web address you see at the top of the slide. We'll also put that in the link, this link in the chat box for you as well. So when you arrive to the portal page, this is the screen you'll see. Before clicking apply, we encourage you to please take time to read through the information on the main page, which includes important information and links to key documents regarding the program and eligibility requirements. So to complete a registration form, you'll be required to have an account with Survey Apply, which is the name of the portal system. So if you don't have an account already, you can click register to create an account. And if you already have an account from previous applications to HEC programs, you can click login and enter your information. So once registered and logged in, you can click apply to begin the application process. And you can see here that the opening date for the registration is today, November 20th. So registration is now officially open. So next slide. So once logged in, you'll see your dashboard that lists the tasks to be completed. And at this stage, your only task will be the registration form. So simply click on this to open and start the form. You can also invite others to help review or complete your form. You simply click on Add Collaborator to send an email invite to another person to join and have access to the registration form. They will need to also set up an account if they do not already have one. The program portal is not just for registration. It will be used to submit to each award opportunity during the life of the program. So when an award period launches, you'll be able to log in and see a new task to submit for the current award. The program portal will also send out email reminders to you when a new task is created and when a task is coming to a close to ensure you have a chance to complete it before the deadline. Next slide. So once you click on the registration form task, you can begin to fill in the fields on the page and click Next Page to move ahead. If you missed a question, you will receive a note and won't be able to move forward until you fill in or correct the required question. There's a total of 6 very short pages to be completed in the registration form, and it should take between 10 to 15 minutes to complete. It's important to note that you can complete your registration form in stages. It will save automatically, and you can return to it at any time to keep working on it. When you reach the final page of the form and are finished, simply click Mark as Complete. This will take you back to your dashboard where you'll have the option to either review your form or officially submit it. We suggest you don't submit until you're 100% confident it's complete and final, because once you submit your form, it cannot be edited. Once your form is officially submitted, you'll receive an email confirming receipt of the registration form. And then once your registration is reviewed, you'll receive a confirmation email notifying you of your enrollment status in the program. If successfully enrolled, you'll also receive additional information about the program and the upcoming activities. It's important to note that a maximum of 500 registered teams may participate in this program, with no more than 75 registered teams being from a single province or territory. So we encourage teams to consider registering for the program as early as possible to ensure that you're enrolled before a cap is reached. Early registration will also allow your team to access all available award opportunities and program supports offered. The latest a team can register and join the program if a registration cap has not been reached is October 1st, 2025. During the registration period, if you have questions or technical issues with the program portal, you can contact us at the program inbox and we'll work to provide support to you and your team. So that's it for registration right now, and I'll turn it back to Nicole for some Q&A.
Thanks, Kirby. And thanks everyone for submitting lots of questions already. And please continue to do so if you have any that have come up about the registration process or anything else. And thanks, Julie, for joining me again. Let's see, where should we begin? Some of the questions in the chat box have already been answered, and thanks, Deanne and other coaches for jumping in as well. Deanne is one of our Francophone coaches from Quebec who was involved in the OPUS program. So there was an early on question about what's the connection with his approach and the OPUS AP. So if you want to go to HEC's website, you could learn more all about the kind of history that Cynthia and Julie shared about how there's been a series of different AUA programs, and then it really grew in Quebec and expanded beyond just antipsychotics. But yes, they were originally related and based on the same early approach. One question was, is this open to for-profit long-term care facilities? And the easy answer is yes, that any long-term care home in Canada is eligible to participate, for-profit, not-for-profit, equally. Also, is this open to long-term care facilities who do not do MDS assessments? No antipsychotic quality indicator. And so I'm glad Cynthia and Julie are back here because we do have questions in the reg process asking, which are you, if you are using, and if not. Again, the quick answer is yes, you can still participate, but for certain awards, you would have to find another way to track, right? Over to you, Julie.
So
wristband?
as your coaches, we will work with you to help you to figure that out. There are ways to track it. Even though you don't use the MDS, we can work with you with the definition from CIHI to make sure that we're all talking the same language, and we can work with you to help calculate that. So maybe just put that note in the registration just so that you get attached to an appropriate coach who can help support you through that. That's what we're there to do.
Yeah, wonderful. Thanks, Julie. Okay. And can we leverage the program we used for last year's HEC funding in BC? Okay, so maybe I'll group a bunch of the BC questions together. Great question about funding. Any of the awards, so the homes that participated last year would have received funding for that work, and that has now closed and been spent and accounted for. This, again, is a bit of a different structure in that instead of seed funding based on agreement to do certain participate in certain activities and have certain deliverables, with the award-based, when you submit for an award, if you win the award funding, there is no kind of financial accounting back to HEC for that. So we've received that question before. And so it's used for your own purposes, not set out specifically, as you might have experienced if you were in a past program with HEC. So Chelsea, I don't know if you can hop back on. There was a few questions, and maybe some of them came in before you had finished all the way, but I think, so in BC, we worked with Health Quality BC to work on AUA. Our health authority has had very promising results. So I think the easy answer is yes. You know, everyone is welcome to join. We know that most homes have worked on this before and continue to, and are at different stages or different rates. And we hope to help you wherever you are currently in that process. So I don't know if you wanted to add anything to that, Chelsea.
I don't see that specific question, but based on what you just said, yes, I agree. So for BC specifically, there are no limits to the number of BC care homes that can participate in the action series. So wherever you're at in your journey, we're happy to support you and work with you. Like, again, just we'll be having some conversations at the beginning to think about how we group homes together in some of those hubs so that you can learn from each other where it makes more sense. But yeah, so absolutely happy to work. And one thing I will say, though, is I believe that some of the HEC awards program is first come, first serve. So while there's no limit to BC homes participating in the action series, that is not true of the awards program. So make sure that you get your expressions of interest in soon on that.
Thanks, Chelsea. And I see you had answered one question about, is the action series only available in BC, already in the chat?
It is, and as much as we'd love to work with everyone, we are a BC specific organization. So in terms of those like direct coaching supports, HQBC will only be providing that for BC homes, but homes across the province have access to other phenomenal coaches, which we've heard about today. So that is something that's still available to you. In terms of the toolkit, the resources, any specific webinars we put on, that will all be made publicly freely available on our website. So that's going to be launched in January, and Nicole and team, we work together closely, so we'll make sure that we are able to provide those links so people who are interested can access it. And it's all very much closely aligned to the type of learning that will be included in the HEC programming.
So just to be super clear, for HEC's program, Pan-Canadian, anyone can register. For BC only. Both have lots of resources and webinars and other things that are accessible to anyone publicly on our websites. And again, just to be super clear, Chelsea, anyone in BC can register for yours. And that's the first step, right? And then do you want to just go over that again quickly? I know you did at the end of your presentation, but just so we're super clear. Yeah.
Yes. BC homes are coming through the action series. So to register, I put the link in the chat box. It is a registration through our Health Quality BC website. And then there's a question there that you can tick off if you're interested in also participating in the awards program. If for some reason you are not interested, you can still participate in the action series. We think it's a great opportunity to do both, but you don't have to do that. So it's an extra tick box in the registration form at the link I put in the chat.
And you'll get a code from Health Quality BC to help you in completing your quick and easy registration with Health Care Excellence Canada. And again, I think this is really important that we coordinate. You saw the slide with like almost a dozen different organizations. There's so many organizations across the country working on this particular issue. So super important that we coordinate and align our efforts. And so we're all working towards the same objective. Okay, there was another question. Let's see, we covered everything for BC. All right. Some questions about registration. Is it okay to add 2 members to registration after submitting the application? And yes, you can. You're able to go back into SurveyMonkey apply. Kirby, I don't know if you had anything else to share, or that's just a simple yes. Oh, still on mute.
Yeah, just a simple yes, I think.
Okay.
Yeah.
Perfect. Thank you.
Maybe just while you look at the questions,
Yeah.
Nicole, I can just add something that has come up in some of the discussions that I've had, has been around the awards. This is a different challenge, a different initiative than any other that I've been known of or have been part of. And the award is just that, it's an award. So that's why it's optional. You can decide to submit for some awards and not others, based on, you know, what's happening in your home, based on your available capacity, all of those things. As is the coaching and the webinars. So, you know, Chelsea talked about the way that BC homes are going to apply, and Kirby talked about how homes outside of BC are going to apply. So you follow that process, you have access to coaches, you have access to webinars, again, all optional, because it is more of a arm's length approach, as opposed to getting right into the weeds. Now, as coaches, we can get into the weeds with you if you want us there, but it's up to you to invite us. So super excited about really meeting homes where they're at and helping to support them move forward, regardless of where your starting point is.
Well put, Julie. Yeah, thanks for underlining that and the unique approach of this program. So just grouping a couple of questions related specifically to Quebec and OPUS. And again, we're really lucky to have Deanne as one of our coaches because she's been involved in the OPUS. And so she'll ensure that the quick answer is, can we participate even if we're deploying OPUS in Quebec? And the quick answer is yes. I wouldn't say that there's conditions, but that Deanne will ensure that you're still primarily following the directives that have already been set out by your ministry in your province. And then this is really an additional opportunity that is in alignment with that. So same with data collected. Yes, we wouldn't be asking you to change your process, and it will be in alignment with the work you're already doing. Will go towards this program award opportunities as well. So we'll definitely ensure alignment in Quebec as well. Are there any costs involved? So there's no cost to be able to participate. I don't know if Julie or Cynthia have, if the question is related to, you know, implementing changes to implement the AUA approach, if you can think of any associated costs that would be required.
So any costs that might be required would be dependent on what of the supportive therapies you decide to employ within your organization. So Cynthia talked about the PIECES education. There is cost associated to some of those resources, not all of them, but some of them. So that would be very much dependent on your decisions. Anything else, Cynthia?
Well, there might also be some auxiliary costs for things like supplies, depending on how you decide to implement your person-centered approaches. I know teams that have put together activity boxes and other kinds of things that has necessitated some costs. So.
Yeah, that's helpful. And again, it could be part of coaching as well. Yeah. Thanks both. Getting lots of questions. Is the participation per home a grouping of long-term care centers? And it is per home. So each individual site would have to register individually. However, there isn't a limit that only one per group or network or corporate organization. It's not limited in that way, just that if there are multiple, each would have to come and register and participate individually. And again, that's there's more information both in our frequently asked questions on the website and in the terms and conditions. And a question again from Opus, if we're already participating there, can we participate without the AUA program? And I think Julie, you did a nice job of summarizing that as well, that yes, the activities and the webinars will be beneficial for those who need it and are able to attend. But as long as you've registered for the program, you're able to choose which award opportunities you submit to. So the answer is yes, you can still participate. Interesting question. Would this program be beneficial for a complex mental health long-term care home where most clients would have a mental health diagnosis, like schizophrenia, bipolar, anxiety, and mood disorders, etc.? And again, I think, Julie, when you were first answering the MDS question, saying, well, we would go back to the CIHI definition. And I think there was also a question about this in the chat that everyone had chimed in. So again, we are using CIHI's definition. So Cynthia, did you want to respond?
Well, I thought, for those complex residents that already have a mental health diagnosis that would be appropriate for antipsychotic use, you won't necessarily be discontinuing those meds on them. You might be tweaking them, but I think more importantly, this program can help you to really look at person-centered care, your care plans a little differently, working together as a team. So I think there's value in joining this for those particular homes.
That's right. And just to add to that, we always talk about, potentially inappropriate use of antipsychotics. Not all antipsychotics are inappropriate. So it goes back to Chelsea's comment about asking the why. The why. Is this class of medication required for this individual? If it is, fantastic. Good work, team. You just checked one off the list, because it is appropriate. But it's looking at those ones that when you ask the question, why, how long have they been on it? Why were they put on it? Is this person still experiencing benefit from this class of drug? And everyone shrugs their shoulders. Those are the ones you want to look at. So it's potential.
Exactly, Julie. And we often hear of people that have been placed on this medication and nobody seems to remember why or what the indications were. Another flag that maybe this is not appropriate for that individual.
Yeah, great point. Maybe one last quick question before we close. Are medical doctors involved and supporting this program?
Well, I think all the home's medical practitioners should be involved. I think you heard me say during our pilot project, Joe and I made specific effort to engage the physician group so that they understood how they were part of the team, what they had to offer, and how they can work together with the nursing department and the rest of the team to support these strategies. So I think that's an important component. Without that component, I think it could be a little challenging and a bit of a struggle. So physician engagement is I think, a critical component.
Yeah, full team approach. Thank you both so much. So with just 1 minute left, I think we'll quickly put up our closing poll. If you do have questions that weren't answered, feel free to reach out via email in our shared inbox, and also check out our FAQ, frequently asked questions, on our website. And thank you so much, all of you, for taking the time to join us and learn more about the program. And I hope you consider registering. And thank you to all of our presenters for sharing today.
Thank you, everyone.
Thank you, everyone.